The use of CT scans has long been celebrated as a cornerstone of modern medicine, powerful, precise, and often life-saving. These scans, which create detailed cross-sectional images of the body using ionizing radiation, are critical for diagnosing everything from strokes to tumors to kidney stones. But behind this technological triumph lies a growing and deeply concerning risk that is too often overlooked. The very same radiation that makes CT imaging so effective is quietly contributing to a rise in preventable cancers. A new study led by researchers at the University of California, San Francisco, reveals a sobering truth. Based on projections from 20 U.S. states, more than 103,000 cancer diagnoses, around 5% of all new U.S. cancer cases in a single year could be directly linked to the 93 million CT scans performed in 2023 alone. This is not a marginal concern. It places radiation from CT scans on par with other major population-wide cancer risks, such as alcohol consumption and obesity. And while smoking still leads the way as the most significant contributor to cancer, the reality is that CT-related radiation exposure is inching into the same territory, yet with far less public awareness or scrutiny. What makes this situation even more troubling is that many of these scans may not have even been necessary. Over the past 2 decades, the use of CT imaging has surged by 35%, and much of this increase is attributed to what researchers call low-value, potentially unnecessary imaging. In simpler terms, patients are being exposed to high doses of radiation not because it's essential for their diagnosis, but because of outdated protocols, defensive medicine practices, or just plain habit. The radiation from a single CT scan is not trivial. A brain scan might emit the equivalent of 200 to 1,600 dental X-rays, and an abdominal scan for a suspected kidney stone could hit as high as 8,000. These aren't rare outliers. They're within the normal range of what patients are routinely exposed to. And disturbingly, these doses vary wildly from one facility to another, depending not on the capabilities of the machine, but on the judgment, or lack thereof, of the technician or physician overseeing the procedure. Despite the massive public health implications, the U.S. still has no federal standards for CT radiation dosages. This leaves patients at the mercy of inconsistent practices and the discretion of overburdened healthcare professionals. A third of scans tested in the UCSF team's ongoing analysis exceeded their own proposed safety targets. Yet patients are rarely informed, and even fewer are told they have the right to ask for lower doses or alternative imaging methods like ultrasound or MRI, which emit no radiation at all. It is particularly alarming that in many cases, multiple scans are performed during a single diagnostic episode, with little regard for whether the additional images actually provide more useful information. Instead of a measured approach, we are seeing a culture of excess, one that needlessly heightens patient exposure to carcinogenic radiation, often without clear clinical justification. While the American College of Radiology responded to the study by cautioning that these findings are based on statistical modeling rather than direct patient data, this distinction does little to undermine the gravity of the projected risk. Statistical modeling is a cornerstone of public health research, and it is the very tool used to establish links between smoking and lung cancer, or sun exposure and melanoma. Waiting for definitive individual cases to pile up before acting would be negligent, particularly when the cost of inaction is the silent accumulation of long-term cancer risk. There is a profound irony in the fact that a tool designed to detect cancer might also be contributing to its spread. Patients often undergo scans under the impression that they are taking proactive steps to protect their health. But without full transparency and regulation, many are unknowingly exposing themselves to a danger that could surface years later, long after the original health concern has passed. This isn't a call to eliminate CT scans. They remain vital in emergency situations and when other diagnostic tools fall short. But it is a call to radically rethink how and when they are used. We need stronger clinical guidelines, more stringent oversight, and standardized dosage protocols. Doctors must be trained not only to read scans, but to critically assess whether one is even needed in the first place. And patients must be empowered, encouraged to ask hard questions like, is there a safer alternative? Or can this skin be done with a lower dose? The existence of websites like Know Your Dose is a start, but it also underscores a disturbing reality. In many cases, patients must take the initiative to protect themselves from radiation exposure their own medical team may not fully address. That should not be the norm. Safety should be built into the system, not left to chance or individual vigilance. If we do not act now to rein in excessive CT scan usage and regulate radiation dosages, we risk allowing a silent epidemic to grow, one fueled not by bad luck or lifestyle choices, but by the very medical system we rely on for our well-being. The technology is powerful, but that power cuts both ways. Used responsibly, it can save lives. Used recklessly, it can cost them. The stakes are high, and the time for reform is long overdue.